Following the forced evacuation of Ethiopian forces and their allies from the most parts of Tigray, the government of Ethiopia has put the region under all-encompassing siege by blocking all the roads that led to Tigray for over 9 months now. In doing so, the central government has terminated basic services such as telecommunications, electricity, and banking. These all have made it impossible for civilians to get on with their lives. Many are suffering from lack of food and medication. Beneficiaries at Freminatos Center for the Elderly, Psychiatric Patients and Children, which is a charity organization based in Mekelle, say that their lives have been greatly affected by the complete siege.
We are suffering from different disease. Many of us have chronic illnesses. However, there is no medicine, foodstuffs as well. We are in desperate situation. The elderly and children are dying due to hunger and lack of medication in front of our eyes.
We used to take medicines prescribed by doctors, but now we couldn't find it, following the blockade in Tigray. Can you imagine? Our last fate is death.
Almaz Cherkos, who is looking after the elderly, psychiatric patients and children, expressed her frustration that the center would be closed unless immediate attention and help is being given by the international community as soon as possible.
They are getting sick. Though we made attempts to take them into hospitals, they couldn't get proper medication due to the siege. If things continue worse like this, the organization may be closed soon. It is well known that this charitable organization brought the patients all from streets. I am afraid they will go back to the streets they used to live in. These are the orphan children. We also have people with psychological disorder. Therefore, I plead to the international community and the members of the Tigray diaspora to help them in any way they can.
Mahari Barihu, board chairman of the charitable organization, on his part stated that the care receivers are fully the vulnerable, such as the elderly, psychiatric patients and children. Mr. Mahari also added that purchasing medicine is not affordable due to the all-encompassing siege. Thus, he called on to various humanitarian partners to fill the gap of his organization's medical stocks.
There is no medicine at all. Even we couldn't purchase from private pharmacies because we have been requested 6,000 birr per patient in a month. Though this problem is common across Tigray, ours is odd in terms of its type and weight. All in all, the international community, Tigrayan diaspora members, and other generous bodies must immediately help this charitable organization so that it will treat its patients like what it usually does.
Care receivers and caregivers at Freminatos Center for the Elderly, Psychiatric Patients and Children, Mekelle, demanded an immediate health care and food assistance. Besides this, they have also called on the international community to put strong pressure on the central government of Ethiopia to end the siege and save millions of lives of Tigrayans without any precondition.